We're going to talk about the 3 C's: cooperate, coordinate, collaborate, because they are the keystone to good teamwork.
Teamwork is very complicated. And if you don't understand the meaning of the 3 words, it's really difficult to build successful, high-functioning teams.
Cooperation is about being willing to work with others to achieve a common purpose.
We're really asking them to think about being in a place and at a time when the whole emphasis of their attention is focused on the key piece of the meeting that's been organized for the team.
The first way you ruin a team is when people don't turn up. You got to be available in time. That means you don't do your BlackBerry messages while you're having a meeting. We have really good evidence that people who are trying to multitask when they're in the meeting are lousy team members. And complementary experience. Lots of teams where there are too many people with the same experience on them. And it's a waste of time and it's a waste of money. You don't need that, okay? Now, what we want then is for everybody to be receptive. They have to have an interest in the topic, so don't bring people into team if that's not their interest. They have to engage in give and take. It's very important that you recognize everybody else on the team has something important to say. And what we know from this is that it begins to build trust and respect.
Cooperation is something that requires a lot of conscious thought. If you're going to have an effective team, is something we've got to think about seriously.
Coordination is getting the work of a team aligned to achieve the best timing and sequencing. Okay? So what we want somebody to do, somebody has to be given the responsibility for organizing the team always. You can't just hand it off and say, oh, well, you'll do it this week or you'll do it next week or whatever. That does not work. So a good team always has a goal that's 6 months out, a year out. Collaboration is much more complicated. It's bringing together a specific and high-level set of knowledge and skills, all right? And those are the things that we learn when we become practitioners, knowledge and skills. These are much more difficult. I'll mention them. I mean, if we knew the answer to changing attitude, changing behavior, we'd have no problem in the Middle East.
The outcome of collaborative practice is when attitude and behavior changes because people have worked together using their knowledge and their skills cooperatively and in a coordinated fashion.
But what we notice happens is that the attitude in poor teams stays poor. The behavior stays the same. And if you don't have a changed behavior, a changed attitude, then you haven't actually built a really collaborative team.
You have to train people to be teams. You know, you have to think right from when they begin their training as a health professional that they're going to work in a team. And all of our educational efforts are totally separated from that notion. We don't train students that way. We never have. Maybe we're beginning to, but we got a long way to go, which is why we have the Canadian Interprofessional Health Collaborative, and that's Brenda's.
We focus primarily on interprofessional education, which is learning together, and collaborative practice, which is working together. We are amassing a large resource on our electronic library, so this will provide some hands-on material, whether it's a curriculum for a course at the undergraduate level or an in-service to be used in a healthcare organization as a start to provide some education and training to help people work collaboratively, because the need is definitely there and we are getting a lot of requests for materials. Many practitioners work as preceptors and mentors to students that are learning either their profession or another profession in the healthcare organization. We can learn a lot from our students because the students are often having interprofessional education courses at their university or their college, opportunities that many practicing professionals never had the opportunity to take advantage of. So we can learn both ways. Then we need support in the field to with our leaders to demonstrate that it is a value. Patients benefit, particularly in some areas of the healthcare system. So for example, with chronic disease management, their care is more coordinated. They have better results because their providers are talking to each other and know what each other is doing, and it's all focused on the best outcome of the patients. If a healthcare organization is running well, people are collaborating, communicating, cooperating, the job satisfaction is higher. People are happier to go to work. The stress and the burnout is lower because there's trust and respect in the workplace. Also, I think it's probably less frustrating if you have a well-oiled machine and you know what's going on, you know what other people are doing. You can focus on what your skills and abilities are really targeted towards, and you work with a team of other people and you're well apprised of what their areas are to focus on the best care for your patient.
We've got to resource this properly. We have to have the right education. We have to monitor it correctly. And then we have to keep looking at it and saying, how do we improve it? By observing the results of good team behavior.